You think you're paying for safety. You think you're paying for peace of mind. You look at that pay stub every 2 weeks and you see that chunk of money missing. Maybe it's $200. Maybe it's $500. It vanishes before it even hits your bank account. And you tell yourself the lie we've all been taught to believe. Well, it hurts to pay it. But at least if something happens, I'm covered. At least I won't lose everything. I am here to tell you that you are wrong. You aren't paying for safety. You are paying for permission. You are paying a massive, bloated middleman for the privilege of maybe, just maybe, getting a discount on a service that was artificially inflated just so they could pretend to save you money. Welcome to the Great American Shakedown. We call it health insurance, but let's call it what it really is: legalized extortion. Look around your city. Look at the skyline. You see those new skyscrapers? The ones with the sleek glass and the logos on the top? They aren't owned by the doctors saving lives. They aren't owned by the nurses wiping sweat off their foreheads in the ER at 3 a.m. They are owned by insurance conglomerates. They are owned by hospital administrators. And they built those towers with your premiums. They tell you the system is broken. That's the biggest lie they sell. They say, oh, healthcare is complicated, the system is broken, we need to fix it. No, the system is working exactly as it was designed to work. It is a machine designed to transfer wealth from the working man's pocket to the corporate boardroom. It is designed to bleed you dry slowly, month after month, and then deny you the tourniquet when you finally get cut. Let's look at the math, because the math is where they hide the bodies. First, you have the premium. That's the entry fee, that's the cover charge, just to get into the club. But once you're inside, the drinks aren't free. No, now you meet the deductible. Let's say your deductible is $5,000. That is a standard number these days. That means you have to pay the first $5,000 of your own money before the insurance company even thinks about opening their wallet. Think about that reality for a second. You pay them $6,000 a year in premiums just to have the policy. Then, if you actually get sick or blow out your knee, you have to pay another $5,000 in a deductible. That is $11,000 out of your pocket before they pay a single dime. If you stay healthy, they keep the money. If you get sick, they fight you on the bill. It is a casino where the house doesn't just have an edge. The house owns the dice, the cards, and the table. Now, let's talk about the price tag. Have you ever looked at a hospital bill? I mean, really looked at it. It's gibberish. It looks like it was written in a code designed to confuse you. Tylenol, $40. A plastic bandage, $80. An MRI, $4,000. Why? Why does it cost $4,000 to take a picture of your knee? Does the machine run on liquid gold? No, the price is fake. It's what they call the Chargemaster price. It is a fantasy number. The hospital sets the price at $4,000 because they know the insurance company is going to negotiate. The insurance company says, we have a deal. We only pay $500, so the hospital jacks the price up to the moon just so the insurance company can slash it down to earth and look like a hero. Look, the insurance company says on your statement, we saved you $3,500. No, you didn't. You created a system where the sticker price is imaginary. It's like a car dealership marking a standard Ford truck up to $200,000, just so they can give you a huge discount down to $50,000. It's a hustle. It's a psychological game to make you feel grateful for getting ripped off. But God forbid you walk in there without insurance. If you walk in with cash, like a normal human being, and ask, how much for this x-ray, they look at you like you're an alien. They don't know. They literally do not know the price of the product they are selling. Imagine walking into a hardware store to buy a hammer. You ask the guy at the counter, how much is this hammer? And he says, I don't know, take it home, use it for a month, and I'll send you a bill based on how much money you make. And who your uncle is. You would laugh in his face, you would walk out. But in healthcare, we accept it. We accept it because we are scared, and they bank on that fear. Now, let's go deeper into the scam. Let's talk about the drug prices. You go to the pharmacy to pick up a prescription. Maybe it's insulin, maybe it's an inhaler for your kid. The price is astronomical, $300. $500, why? Enter the pharmacy benefit manager, or PBM. These are the middlemen you've never heard of, but they are stealing from you every single month. These companies sit between the drug maker and the insurance company. They negotiate rebates. Basically, they tell the drug company, if you want your drug on our list, you have to pay us a kickback. The drug company says, okay, but we have to raise the price of the drug to cover the kickback. So the price goes up. The PBM gets rich. The insurance company gets a cut, and you get the bill. You are paying for the kickback that allows them to screw you. It is a circle of corruption that would make the mafia blush. And then there is the network trap. This is the invisible fence they build around your life. You pay your premiums, you follow the rules, you go to the in-network hospital, you think you're safe, but then you get the bill. Balance billing. That's the technical term. I call it robbery. See, the hospital building might be in your network, but the anesthesiologist, the guy who puts you to sleep, he's an independent contractor, he's out of network. The radiologist who reads the scan in the basement, out of network. The ambulance that picked you up off the pavement when you were bleeding, definitely out of network. You don't get a choice. You are unconscious. You can't interview the doctor before he saves your life. You can't negotiate rates while you're having a heart attack. But 3 weeks later, the letter comes. The insurance pays what they want, and you are on the hook for the rest. Thousands of dollars, because you had the audacity to have an emergency on a Tuesday when the in-network doctor was on his lunch break. They rely on you being too tired to fight back. They rely on the fact that you have a job, you have kids, you have a struggle just to keep the lights on. You don't have time to spend 6 hours on hold listening to smooth jazz, waiting for a claims specialist who is trained to say no. That is their business model. Wear you down. Delay, deny, defend. They have algorithms, computer programs that flag claims just to see if you'll give up. They know that for every 10 claims they deny, only one person will actually file an appeal. It is cheaper for them to deny valid claims and pay the lawyers to fight the one guy who pushes back than it is to just pay what they owe. And who are these people denying your surgery? Is it a specialist? Is it a top-tier surgeon? Usually, it's a medical director sitting in a cubicle farm 3 states away who hasn't seen a patient in 20 years. Sometimes, it's not even a human. It's an AI scanning for keywords pre-existing. Not medically necessary, experimental, not medically necessary. That is their favorite weapon. Your doctor, the guy who went to medical school for 8 years, the guy looking at your actual MRI, says you need this surgery to walk again. The insurance company, looking at a spreadsheet, says, nah, not necessary. Try some physical therapy and some ibuprofen. Why? Because the surgery costs 50 grand and the ibuprofen costs 10 bucks. They aren't making a medical decision. They are making a financial decision. They are gambling with your ability to walk, to work, to live, just to protect their quarterly earnings report. Let's look at the workforce. In the last 40 years, the number of doctors in America has grown a little bit. But the number of healthcare administrators, the paper pushers, it has exploded by 3,000%. 3,000%. What do? Do they cure cancer? Do they fix broken bones? No, they code bills. They argue with other administrators at the insurance company. They manage compliance. It is a massive, bloated bureaucracy of people fighting over your money. For every doctor trying to help you, there are 10 people whose only job is to figure out how to get paid or how not to pay. And you are paying the salary of every single one of them every time your premium goes up. It's not because medicine got better. It's because the CEO of United Health needs a new yacht, and the Department of Claim Denials hired 20 new adjusters. This brings us to the golden leash. Why do we put up with this? Because they have tied our health to our jobs. You can't quit your job because you'll lose your insurance. You hate your boss? Too bad. You need the dental plan. You want to start your own business? Good luck. The premiums for an individual plan will bankrupt you before you sell your first product. This system kills innovation. It kills freedom. It keeps you docile. It keeps you showing up to a job you hate because you are terrified that if you leave, one bad diagnosis will destroy your family. And it is destroying families. Did you know that medical debt is the #1 cause of bankruptcy in the United States? Think about that. Not gambling, not bad investments, not spending money on fancy cars, getting sick. Hardworking men. Men who saved their whole lives. Men who did everything right. They paid their taxes, they mowed their lawns, they raised their kids, and then at 50 years old they get cancer. And within 2 years, everything is gone. The savings, the retirement, the house wiped out. In what other industry does the customer go bankrupt for using the product? If you buy a house and it burns down, the insurance pays to rebuild it. If you buy health insurance and your body breaks down, the insurance looks for a loophole while the hospital sends a collection agency to take your truck. It is a predator class feeding on the working class. And don't look to the politicians to save you. They are in on it. The healthcare lobby spends more money in Washington than almost anyone else. They spend more money buying politicians than the defense industry. Why? To keep the game rigged, to make sure we don't get price transparency, to make sure they can keep their monopolies. They write the laws that protect them from you. So what do? What does a man do when the deck is stacked and the dealer is cheating? First, you have to wake up. Stop believing that they are there to help you. They are not. They are a business. You are a liability. Second, start asking for the cash price. You would be amazed if you need a procedure, an MRI, a minor surgery. Ask the provider, I don't want to use insurance, I'm paying cash, what's the price? Often, the price drops by half, sometimes more, because they don't have to deal with the paperwork. They don't have to fight the insurance company. There are surgery centers now, like the Surgery Center of Oklahoma, even take insurance. They post their prices on a menu online like a fast food joint. Hernia repair, $3,000. Knee scope, $4,000, no surprises. No bills in the mail 3 months later. Look for them. Vote with your dollars. Third, look at the alternatives. Look into direct primary care. This is a movement of doctors who have walked away from the system. You pay them a flat monthly fee, maybe 50, maybe 80 bucks. No insurance for that fee. You get their cell phone number. You get unlimited visits. You get wholesale prices on labs and drugs. It's how it used to be. Just you and the doctor. No middleman, no administrator telling him he cannot treat you. It brings the power back to the patient. And finally, the hardest truth of all, take care of yourself. The best way to beat the health insurance scam is to not need them. They want you sick. A sick patient is a profitable patient. A guy on 5 different medications for the rest of his life is a goldmine for the pharmaceutical companies. But a healthy man, a strong man, he's a nightmare for them. He doesn't need their pills, he doesn't need their procedures. Eat real food. Stop eating the processed poison they sell in the aisles. Lift heavy things, get sleep, cut out the alcohol. They want you fat, weak, tired, and dependent. They want you hooked on their meds and terrified of losing your coverage. Don't give them the satisfaction. The system is rigged. The game is fixed. The house always wins. But that doesn't mean you have to play by their rules. You can opt out. You can find alternatives. You can get strong. You are the only one coming to save you. Not the government, not the insurance company, not the HR department. You. Protect your wallet. Protect your freedom. And never ever trust a system that profits from your pain. Stay sharp.